Hello everyone, this is Crystel. So this is part 2 of my NCLEX journey. In my previous video, we talked about my NCLEX application under the state of New York. Today we'll be discussing how I passed at 85 questions. So first, let's start discussing about the need to know about the NCLEX. So number one, some of you may be a little bit confused regarding the meaning ng stopping or passing at 85. So sa NCLEX kasi, merong minimum of 85 questions and then maximum of 150 questions. So it will depend on the examinee. And you need to finish the exam within 5 hours. So depende yan kung magsasop ka ba ng 85 or aabot ka ng 150 question, kailangan matapos mo siya ng 5 hours. So it's also about managing your time when it comes to answering your questions. So if you do well, you will pass at 85. And pag umabot ka naman or nag-exceed ka sa 85, it doesn't mean na you're failing or you're doing bad. It just means na you're still in the game, you still have a chance to pass the NCLEX. So when you pass at 85 questions, meaning you really did well on your exam. And minsan naman, may magsastop at 85 pero hindi rin pumapasa. So marami rin nagtatanong kasi kung ano yung passing grade sa NCLEX. So I think wala talaga silang specific passing score na hinahanap tulad ng PNLE, diba? Pero sa kanila kasi parang yung computer magde-determine if nababalance mo ba yung score mo, whether more on nagkakamali ka ba or natatama mo na. Kaya yung iba, nagpapass sa 85 questions kasi na-hit na nila yung parang ceiling grade or okay na yun. Meaning they are already a safe nurse and hindi na nila kailangan mag-move forward to get scores. So number 2, it's a computer adaptive test as I've mentioned earlier. So ang pagkakaintindi ko sa computer adaptive test, the computer will determine kung anong type of questions yung ibibigay sa'yo. Specifically doon sa first 10 to 15 question kung anong lalabas sa'yo. So kung natatama mo yung first 10 to 15 question and naging satisfied na yung computer na okay, alam niya tong topic na to, or she or he is a safe nurse when it comes to these procedures, okay na yun, mag-move on na siya to a different topic. Pero pag nagkakamali ka na nagkakamali doon sa topic na yun, for example, pharmacology, mostly yun daw ang ibibigay sa NCLEX mo. So, wala talagang set A or set B compare sa PNLE, di ba? Meron tayo talagang set A or B per year, nag-iiba-iba yung question, di ba? Pero halos pare-pareho naman talaga, nag-iiba lang yung numbering ganon. Pero sa NCLEX kasi, very personalize siya to you, to your performance, and ano yung mga strong and weak areas mo. So for this NCLEX, ang tawag na kasi sa kanya is New Generation NCLEX or the NGN. So I will be putting a link in the description box regarding videos na nagdi-discuss about the NGN. Kasi iba na siya doon sa lumang NCLEX, meron na siyang mga case studies and madami ng type of questions. Hindi na lang siya parang multiple choice. And then for the scoring system also, I will be also putting a link in the description box regarding na dinidiscuss ko ano yung scoring system sa NCLEX para makuha rin kayo ng mga tips and techniques kung paano ba kayo mag-answer during your exam. So now let's proceed regarding my NCLEX review or preparation. So number 1, what topics did I include? So, I found this NCLEX coverage from RN Progress Online. And dito ako mostly nag-base ng mga topics na inaral ko. And I don't really have a link of this. Hindi ko na siya mahanap. But I will be sending this to my IG broadcast channel. And I think it's really best na mag-research pa kayo regarding ng mga topics na included sa NGN. So, number 2 is how many months did I prepare and how many hours did I review per day. So I started seriously reviewing around mid-April and then until the end of August. So about 4 months ako nag-review. Since nakuha ko yung ATT ko around April 27 and then ang earliest date kasi na available na is August 30 and then ang kinuha ko na lang is September 2 para Saturday siya. So for review, medyo chill lang siya since hindi ako nagka-cram and mahaba nga yung preparation time ko, 4 months. Compare nung PNLE, medyo nag-cramming ako nun Kaya nitong NCLEX, mga 6 to 8 hours per day lang ako nag-aaral. And ano pa yun, I really take my time to review. Hindi pa siya parang nagmamadali ako. Compared dun sa PNLE, around mga minimum 12 to 16 hours ako per day. Pero mabilis pa ako mag-review doon. Parang naghahabol talaga ako. Number 3 is, what is my study calendar or schedule? So this is a sample of my study calendar for the month of May. So you can look up a lot of study calendar or schedule for NCLEX sa Google. Mas maayos dun kasi akin medyo magulo and, or should I say, personalized. But I will try to make a more organized NCLEX schedule if I have time. And once it's done, I will send it also to my IG broadcast channel. So I base my calendar from my weakest to strongest areas or systems or topics. So inuna kong aralin yung mga topics or system na nahihirapan akong intindihin, madalas kong makalimutan, or hindi ko talaga siya memorize, or madalas akong magkamali. Para mas mabigyan kong time yung mga weak areas ko. So in order for you to know your strong and weak areas, you can do an online assessment. Marami kayong makikita sa Google niyan in order for you to determine kung ano yung mga weak areas or topics nyo. So per day, as you can see in my calendar, I try to finish one system. So included na lahat doon ng mga diseases. Pero minsan kasi diba may mga system na maraming topics. For example, cardiovascular, maraming included na diseases doon. So, pag mga ganon, minsan 2 days ko siyang tinatapos or minsan 3 pa nga eh. So, from April to June, nag-focus lang ako sa mastery of concepts. I really tried to understand all of it from the heart na hindi lang memorization. Kasi ang mindset ko, hindi lang to para makapasa ko or para makuha ko yung license na yon. Niisip ko na gagamitin ko rin to in the future when I practice as a nurse. So, I really need to know this and I really need to envision myself as a nurse na ginagawa ko to. So, para mas matandaan ko siya. So, that can also be your motivation na yung inaaral nyo, hindi lang naman siya mag-stop sa exam. So, gagamitin nyo rin siya. Then starting July, I started incorporating na mag-answer ng Q-banks as well as learning techniques on how to answer the NCLEX. So number 4, the most asked question of all time, did I enroll in a review center? So yes, I enrolled sa NCLEX Amplified. So sila na kasi yung pinakamurang nakita kong review center. I paid 8,499 pesos and the good thing about them is only yung review. So, wala siyang limit na parang 3 months lang or 4 months. So, you can review with them until you pass. So, yung review nila is done online through Zoom. So, pwede kayong sumali dun sa live review mismo or pwede rin naman kayong mag-replay ng mga live videos doon sa website nila. So, bibigyan nila kayo ng account to access all of the videos. Even though I enrolled here, 90% of the time, self-study lang talaga ako. I'm not saying na hindi maganda yung review center. They have a high passing rate. It's just that I think it's not for me kasi diba live review siya and everyone has access sa mga mics, mag-on ng mics and I really get distracted to that. I also prefer din kasi yung straight to the point na discussions or review. Ayoko na masyadong distraction na, yes, we can joke about the diseases, pero I want the jokes to be really related to the disease or the topic. Kasi minsan pag medyo off or malayo yung joke, hindi ko, parang mas nalilito pa ako, parang mas naguguluhan ako. And kahit nasabi nating review kasi yun, gusto ko pa rin na well-elaborated yung discussion. Gusto ko kasi nalalaman pa din kung paano nanggagaling from point A to point B. For example, yung mga diseases, di ba? So, from etiology niya, to its signs and symptoms, treatment, and also its purpose. Parang ganun. Ayoko nung parang medyo magulo. So, this is based solely in my experience, guys. And wala kasi akong masyadong ma-recommend na review center since nung PNLE nag-in-house review ako sa UST, hindi ako nag-enroll outside. And then, ito nga NCLEX. Yung NCLEX Amplified lang yung na-try ko and then mostly self-review. But of course, I will share the materials I use for my NCLEX review. So, ano ba yung mga materials na ginamit ko? So, number one, ginamit ko pa rin yung PNLE notes ko. So, kung kayo, fresh graduate kayo, nasa inyo pa yung mga PNLE reviewers nyo, you can utilize that para hindi na kayo mag-back to zero sa mga reviewers. You can utilize that. And then I also shared my flashcards sa TikTok. You can check it out. Meron dong playlist na flashcards or notes. And then number two, I also utilize Mark Klimek. Meron akong materials nito and also share this sa G-Drive link ko sa IG broadcast channel. Then number three, I love watching Simple Nursing on YouTube, si Nurse Mike. Marami talaga siyang nabigay ng mga techniques and commonly talaga yung mga sinasabi niya. Yun yung mga topics or tricks na lumalabas sa NCLEX. So, I really love Nurse Mike. So, sa YouTube lang kasi ako nanood doon. But if you have the budget, alam ko meron silang subscription sa Simple Nursing. Meron silang review din for you to access all of their videos and also yung mga Q-Bank. Number 4 is I also tried UWorld. So sa mga nagtatanong kung ano yung Q-Bank na ginamit ko, so mostly nag-UWorld ako. Maganda kasi yung formulation nila ng question and meron na rin mga rationale. And then I also tried Lecturium, but I would really recommend this for nursing students kasi more on mas medical sila and technical when it comes sa Q-Banks nila. And the good thing about them is meron silang mga lecture videos as well as lecture materials for nursing students. Now let's go over my study tips or hacks. So I've discussed some of this in my TikTok video. So, medyo mas active kasi ako doon, guys. Kasi mas mabilis nga mag-upload. Mas mabilis mag-answer ng questions nyo or communicate with you. So, marami na akong mga naka-upload na tips din. Meron din akong playlist na tips doon. So, number one, na-mention ko na to ilang beses sa TikTok ko is the all-in-one notebook. So, ito yung ginawa ko during my NCLEX review. So, lahat ng pinag-aralan ko na from lahat ng diseases, topics, sinulat ko siya sa isang notebook. Lahat nandun, pero shortened na lang yun. Kung ano na lang yung mga need kong tandaan para I can bring it anywhere with me. Makakapag-review ako kahit na mag-travel ako or punta ako sa ibang lugar. Nandun na lahat. And at the same time, mas maaalala mo siya since sinulat mo nga or nire-write mo siya ulit. So now let's proceed on my tips how to focus better. Number one is utilizing the Pomodoro technique. So yung Pomodoro technique is you study for 30 minutes and then rest for 10 minutes. Or you can also utilize it based on your preference. Ako kasi ginagawa ko, so 45 minutes studying to 1 hour and then 15 minutes na rest. And then yun yung cycle mo. Number 2 is listening to lo-fi music on YouTube. So, madami kasi sa YouTube din na nag-upload ng may background music na parang you're studying with them habang naging productive sila or nag-study sila. May mga nag-upload ng ganyan and then may background music na and then kinakat-cut na rin nila parang based on Pomodoro. So, parang all-in-one yung utilize ko doon sa YouTube na yun. Meron ng Pomodoro and then at the same time, meron na rin background music and then you feel like na nagsa-study ka or meron kang study body kasi nga pinapakita nila doon na they're being productive. So, yun yung nag-work sa akin. And then number 3, sinadjust to ng best friend ko from college. Meron siyang sinalihan na Discord channel. Or alam ko maraming Discord channel na ganda talaga yung parang mga students all over the world na papasok kayo doon sa channel na yon and then dapat naka-on camera kayo. Pero wala naman talaga nagsasalita kasi hindi naman ata na-access yung mic. So parang nafe-feel nyo lang na yun nga, nagsa-study kayo together. So you can also do that. Pero hindi ko yun masyadong nagawa. So, study hack number 3 is the Feynman technique. So, nato ko lang siya nalaman na ito pala yung term sa ginagawa kong study technique. Kasi, when I study, I really like to discuss it to myself. Parang nag-a-act ako na I'm teaching someone. So, parang ganun yung Feynman technique. You learn the concept, you review it, and then you try to teach it Ang sabi pa nga doon is you act or you try to teach it to a child and then review again the concept. And then you organize or revisit your notes regularly. I think kahit na sinulat mo na yan sa all-in-one notebook mo and ilang beses mo na binasa, I think it's also really best to reread and reread for better retention and at the same time, hindi ka nagkakamali. Kasi meron time na feeling ko, ito yung sagot na to, parang sure na sure ako, pero when I go back to my notes, parang hindi pala yun. Parang minsan nami-mistaken natin yung concept na yun. So it's best to reread and reread again. Number 4 study hack is to visualize what you are learning. So you can watch a lot of YouTube videos na may mga animation sila when they're discussing yung mga concepts. Number 1 example na dyan is si Simple Nursing. And then, nung first year college ako, si Crash Course. So, for me kasi, visual learner talaga ako. So, gusto kong may nakikita or pwede naman na mag-drawing kayo para ma-visualize nyo. Or you can search pictures ng mga organs or system para alam nyo kung ano ba yung magkakalapit, kung saan siya nanggagaling. Para mas ma-envision nyo kung bakit nangyayari yon sa body natin. Or for example, bakit nagiging ganun yung isang disease. Number 5 is to make or research your own mnemonics or acronyms for you to memorize faster and for better retention na rin. So ito yung isa sa mga sumikat kong TikTok videos because I've shared a lot of mnemonics about different topics. So you can also check that out on my TikTok account. Now, let's proceed to test-taking strategy. Number 1 is to learn and master prioritization. This is one of the most important skill you need before you take the exam. Kasi ang dami kong nakuhang prioritization question. So this will fall under your ABCs. Example of prioritization questions are, which patient do you need to see first? Or what signs or symptoms need urgent intervention? So parang ganun. So as I mentioned earlier, di ba, sobrang love ko si Simple Nursing or si Nurse Mike sa YouTube. So, marami siya talagang diniscuss na ABCs. Disclaimer lang guys, hindi ibig sabihin marami akong nakuhang prioritization question. Ganun na rin sa lahat. As I've said earlier also, personalized talaga yung NCLEX. So, maybe yun yung weak area ko rin. Kaya yun yung nabigay sa akin. Number 2, in a select all that apply questions, I only pick the choices na I'm 100% sure correct. Kasi merong klase ng select all that apply question na right minus wrong. So, sayang naman kung, for example, dalawa dun sure ka, tapos isa hindi ka sure, tapos pinili mo pa rin yun. So, imbis na 2 points yung makuha mo, magiging 1 na lang kasi nga right minus wrong. So, diba, sayang. Instead na kunin mo lahat or piliin mo lahat, mas okay na yung piliin mo kung saan ka sure na sure para hindi ka mabawasan ng points. Number 3 is be careful sa mga trick questions kasi maraming ganyan. So, make sure to read it twice before going to the next question kasi hindi na kayo makakabalik sa previous question. So ako during my exam, may mga times na tumatagal talaga ako sa isang question ng 3 minutes or more kasi nabablock out ako or nagpapanik ako kasi hindi ko alam or nakalimutan ko. So, nag-stay ako doon and I try to relax my mind para maisip ko siya ng mabuti. Number 4 is to make sure you know your interventions kasi maraming interventions na tinatanong sa NCLEX. So, sometimes they will ask you what's the best or first intervention. So, di ba? What's the difference between best and first? So, best intervention kasi is yun talaga yung standard or yun talaga yung dapat mong pinakagawin sa patient for him to recover quickly or for him to get the best care, di ba? Pag first intervention kasi or immediate intervention, yun yung parang mga urgent, yung parang kailangan agad-agad ito na yung gawin mo kasi ito lang yung meron ka, ito yung pinaka-accessible na material sa'yo, kaya ito yung ginawa mo sa patient. May mga ganun, okay? So, you guys need to learn or to research more on that. Okay, last part is during the exam. So, what do you need during your exam? Number 1 is ang kailangan nyo lang talaga dalhin is your passport. Wala na kayo ibang kailangan daling nagamit. And then, you can wear comfortable clothes. Ako kasi naka-pants and then long sleeve lang ako noon kasi medyo malamig, so you can bring your jacket. Mas maganda daw pag yung jacket na dinala mo is yung cotton and not yung windbreaker. Kasi yung windbreaker daw, maingay yun. So, hindi nila pinapasuot yun dun sa testing room. And then number 2, you will be given instructions naman once na makapunta na talaga kayo dun sa testing center nyo. So, medyo marami pa silang ipapabasa bago kayo papasukin sa testing room. So, relax lang kayo. Basahin nyo lang yon yung mga rules and policies nila para hindi ma-forfeit yung exam nyo. Number 4 is don't lose hope pag hindi tumigil at 85 question yung computer nyo kasi automatic siyang mamamatay pag stop ka na or tapos ka na. So, don't lose hope kahit na hindi kayo stop ng 85, meaning you're still in the game, you still got this. So, just do your best. Huwag naintindihan yung number of questions. Just focus on the question dun sa sasagutin nyo. So, huwag nyo intindihan yung minimum. Pag nag-stop ng 85, then let's hope and pray na it's a pass, diba? So, number 5, I finished my exam for 2 hours, yung 85 question. And yun nga, na-mention ko earlier na mukhang mabilis yung 2 hours, pero may mga questions talaga na nag-stop talaga ako. Kasi especially during the first 10 questions, kasi doon, syempre kabado ka pa. So, may times na nag-blackout ako kahit alam na alam ko naman. So, may times na nag-blackout talaga ako kaya na-stop ako dun sa question na yun for about 3 to 5 minutes. So, that's it for today's video. I hope you learned a lot. I hope may marami ako na-share sa inyo about my NCLEX journey. So, if you have any more questions also, you can drop it in the comment section or you can comment it in my TikTok videos kasi most of the time, mas nagiging active ako doon sa mga TikTok videos ko. Mas madali kasing mag-explain sa isang question with a video para mas ma-elaborate ko siya. So, yun, you can follow me on my social media accounts. It's also in the description box below. And let me know what videos should I do next here on my YouTube. Bye!